Hello there. Welcome to my show, COVID-19 Update by Heerak. Today is October 13th, 2020, and it's Navy's birthday, U.S. Navy's birthday. Happy birthday, Navy. October 13th, 1775 is when United States Navy was born. As you know, United States Navy is probably the best Navy in the world, although Chinese Communist Red Army is trying to build a superior next generation Navy. Let's see if they succeed. That's their goal. They do have a lot of money from all the trade, and there aren't that many people suffering from COVID in China. So we expect Chinese economy to expand aggressively, while unfortunately in the United States we have a lot of COVID death every day. So U.S. economy will shrink. So Chinese wealth will grow, U.S. wealth will decrease. That's the unfortunate reality right now because of COVID-19. Uh, so probably flattening the curve is probably the priority for maintaining America's economic growth potential. As you know, it's October, so in Germany, Oktoberfest is very popular. I don't know if you have been to Germany and have been to Germany during Oktoberfest time, but Germans have this very vibrant beer hall culture. Germans have this thing called Mass, which is like 1 liter beer cup. It's pretty big. It's a big German Mass. And Germans like to drink, listen to German folk music, like the music you're listening to in the background. Sometimes they like to sing along to German folk music. Germans have a very proud history. They're the one tribe. They're the tribes. Germanic tribes were not conquered by the Romans during the Roman Empire. They roamed basically free, and they're considered among the greatest warriors. And you see the photo. I was there in Germany for International Organization for the Study of Old Testament conference in Munich that was held at Universität München, University of Munich. It's a every 3 year conference on the study of Old Testament that brings together all the top scholars in the world who focus on Old Testament. So I was invited to deliver my academic paper on that, on my research, which is Second Temple period, during the time of the first Hanukkah, the Maccabean revolt. So I presented my paper, and I had some time uh, to spend. So I spent a few days, in Frankfurt, and Frankfurt was having apple cider festival. Um, so I hung out with some friends that I made at the festival site. So I met these three beautiful German women. And we hung out, just kind of spent some time together, drinking apple cider. Um, it was fun, and they were just kind of being wacky and making faces for the camera, you know. They're really funny, We had a lot of fun. Um, yeah, people can be really nice, and I think Germans are very nice. So I had really great time spending together with Germans. Um, yeah, um, yeah. In last 24 hours, we have 557,000 COVID-19 deaths. Um, yeah, it's a little bit less than 24 hours, but yeah, yeah. It's probably like an off day. You probably want to see way over 1,000 deaths. Um, and that's been the average over 1,000. So I would, it's like around 600. It's close to 1,000, but it's probably more, like over 1,000. So a few hours later, it will probably hit 1,000. Um, anyway, You know, we have 6 months of flu season to go, and as you can see, infections are you know, pretty high, and it's continuing. We're having like record infections right now, and new infections result in death. So you know, COVID-19 death during the flu season is going to be horrific. Um, yeah, unfortunately, Germany is seeing a sharp spike of COVID-19. So is Europe. So it seems like Europe is headed to perhaps millions of deaths in the next 6 months of flu season, unfortunately. So a lot of areas in Germany are shut down by law, and in England as well, and in France. So they're beginning to shut down. Obviously, there are 6 months to go. So you should probably anticipate whole countries shutting down, France, Germany, and England and Spain and other countries as well. Obviously, you have to shut down if you don't want people to die. That's the only way to save people's lives. I mean, you can risk it. If you want to risk people's lives, they could keep open, but people will die. And look at America. We have like over 500 people dying every day, more like 1,000 people dying every day on average, because places that should shut down are not shutting down. You know, you cannot go to zero death. I mean, you probably can't go to zero death, but you cannot reduce the death. It is a global pandemic after all. You cannot reduce the death if you keep things open. Just, you know, if you have like over 40,000 people getting infected every day, there's no way you're going to reduce the death because more infections equal more death. So it's like simple math, right? If you have 40,000 people getting infected, you're going to have, you know, hundreds or thousands dying every day, you know, because infections mean that some of them will die. You know, it will get severe enough that some of them will die. So right now we have 215,439 deaths and 7,817,863 infections in the United States alone. Um, you know, we had a serious problem in the summer with COVID-19 infection spreading. We had an average of 1,000 people die per day, like in August. So things are really bad in America, but it's about to get worse. Um, you know, most colleges will have to close academic year 2020 to 2021, and perhaps even academic year 2021 to academic year 2022. COVID-19 is expected to stay forever. It's like a 365-day a year virus. You know, we see in America that there are infections every day, there are deaths every day. It's not going to go away. It's like HIV virus or hepatitis C virus. Once we discover them, they haven't gone away. There are infections every day. There are people dying every day. You know, maybe not every day, but there are people dying in large numbers every year. But COVID-19, people are dying every day since it arrived in America and proliferated in New York. You know, you should worry in America. I mean, I'm in America, so I'm worrying, obviously, and I'm sharing my concerns with you, obviously, because you need to know what's going on in order to protect yourself and your children from COVID-19 death, right? If you're just like ignoring the science, ignoring the data, then you can become one of the numbers that die in COVID-19 America in 6 long months of flu season. So you need to know where we are. I'm wearing University of Pennsylvania mask because I got my bachelor's degree there. University of Pennsylvania is a very good nursing school. They say they have the best Bachelor of Science in Nursing program. That's what they claim. Obviously, Johns Hopkins says they have the best Bachelor of Science in Nursing program. But you know, University of Pennsylvania's Bachelor of Science in Nursing program is very good. If you want to become a nurse, you could apply early decision by November 1st. You need to submit applications in by November 1st to be in the Bachelor's of Science in Nursing program at University of Pennsylvania. I'm going to be interviewing you maybe because University of Pennsylvania, you know, Office of Undergraduate Admissions and Alumni Interviews. That they asked me how many students I want to interview. I said, well, for early decision, I interview about 10 people. Regular decision, I'll interview about 15. So I interviewed like 29 people for the last application cycle. So this application cycle, I'll probably interview around that many as well. Um, I've been interviewing high school seniors who apply to University of Pennsylvania and submitting interview reports to the admissions office to help the admissions office at University of Pennsylvania for over a decade. So, I'm like household name over there at the University of Pennsylvania Office of Undergraduate Admissions. Yeah. So, yeah, and there are Europeans who apply. When I was in England, I was a board member of the University of Pennsylvania Alumni Association of the United Kingdom, which is the biggest University of Pennsylvania Alumni Association outside of America. I was a board member there, and I interviewed high school students who applied to University of Pennsylvania from like exclusive boarding schools in England. Um, and it was kind of interesting, learning about the systems and the students' perspectives and the cultural backgrounds. Although, some of the students that I interview are like billionaires from India who are going to boarding school in England or Scotland. Uh, you know, um, and some were like billionaires from like other Asian countries. So they weren't all English people, but I interviewed like an Iranian elite who was going to an exclusive boarding school in England. It was kind of interesting to hear about Iran. I enjoy interviewing high school seniors who apply. You learn a lot, from the interviews as well. So, yeah, Europe is seeing a sharp spike in COVID-19 cases right now. And as I said, a lot of the places are beginning to shut down. Um, so, there's an anticipation that millions of Europeans will die in the next 6 months of flu season. And, it's a COVID-19, it's going to spread and kill. I mean, what do you expect, right? It's a virus. That's what virus does. Um, yeah, so top five COVID-19 cases. Number one is Russia. It has 1,318,783 cases. Death rate is at 22,834. But we don't know. Maybe we'll see like a sharp spike over this 6 months flu season. Russia may become like India. Who knows, right? India is just going out of control right now with COVID-19 death. And we talked about that before. And we'll talk about it again. Today, we're just kind of talking about Europe. Number two, second ranked two in terms of cases is Spain with 896,086 cases. And the deaths are at 33,204 deaths. So 4% death rate. Um, France is 797,426 cases, 4% death rate, 32,961 people have died so far. So before Latin America became the continent of death, because Brazil is out of control, Mexico is out of control. Many places in Latin America are spiking right now in terms of death and cases. So flu season, 6 months of flu season is going to see millions of people die in Latin America. That's where the countries are headed, unfortunately. But that doesn't mean like Europe is going to stand aside and just let people in Latin American countries, South America, like Brazil or Central America, like Mexico, Colombia, Peru, have all these deaths, right? Many countries in Europe will see tremendous number of deaths, and some countries will have probably over millions of deaths. Um, yeah, so it's going to be a horrific winter because there are several continents that are highly compromised in terms of COVID-19 infections and deaths. And so, I'm Heerak Christian Kim, independent candidate for U.S. Congress in Virginia's 8th District. And so I'm predicting that, minimum 100 million people around the world will die in the next 6 months. We're talking about half a year. Next half a year, so until next May, we're going to see a lot of death. If you remember, World Health Organization said don't wear a mask in March. You remember that? Dr. Fauci said, don't wear a mask, like in March. Dr. Sanjay Gupta in CNN said, don't wear a mask in March. Heerak Christian Kim, I always said wear a mask since the show began officially on April 2nd. I've been saying that. Before that, I've been tweeting it. Um, and I've been proven right that you need to wear a mask, right? So I'm sure I'm going to be right again over World Health Organization, Center for Disease Control, National Health Service in England. When these people were saying don't wear a mask, Heerak Christian Kim, independent candidate for U.S. Congress, said wear a mask. United Kingdom is likely to see over a million deaths. They have they're number 4 right now at 637,703, a 7% death rate. 43,108. The problem with countries like England is that they want to protect their economy. But the problem is, in order to protect their economy, they're still thinking they have to operate from a 2019 economic structure where people are going to work physically. And that means people are going to die because COVID spreads from person to person. So because England is working so hard to save their economy, that could be the direct cause for why England can have millions of deaths. When you're trying to prioritize economy and not life, it's expected that a lot of lives will die. Look at America. The United States has taken the decision to prioritize economy over saving lives. So we have anywhere from 5,000 to 1,500 people dying every day in the summer, right, in America, every day. Because United States as a government, and this is for Democrats and Republicans, have prioritized the economy over human lives. So we have over like an average of 1,000 dying per day. You know, whatever your priorities are, that's what will determine what the outcome will be, right? If you want to save lives, you have to shut down. If you don't shut down areas where outbreaks are happening, you're going to have multiplicity of deaths. And that's what we're having, right? Florida should have shut down, but it didn't shut down. Texas should have shut down, but it didn't shut down. California should have shut down, but it didn't shut down. So they all are going to have tremendous number of deaths in the flu season. You know, that's just expected when you prioritize economy over life. And some people feel like, it's worth having 1,000 people die per month, per day. Sorry, per day, not per month, per day, to maintain our economics, our wealth. I mean, I don't agree with that. I think human life is more important than wealth or economic strength. Um, and actually, to be honest with you, because COVID-19 is forever, it's not going to go away. It's a 365 days a year virus like HIV virus and hepatitis C virus, which haven't gone away after many, many decades. What I am proposing is we need to adjust our economy to accommodate the new reality, right? Transition our workforce and workplace from a physical one to the one where it can be optimized in the context of a family where or whole family home where workers are working remotely at home. We need to develop new technologies to support that. And also we need to build better respirators, like next generation respirators where people can wear it and not get infected in public. You know, we have to figure out ways for people to be able to eat and drink in public without getting infected with COVID. So those are things that we have to develop. Um, but unfortunately, neither the Democrats or the Republicans are prioritizing advancing new technologies to adapt to COVID-19 America. There is a supposition or there's a bias that COVID-19 will just go away on its own. Democrats are thinking that, Republicans are thinking that, liberal media is kind of pushing that narrative. And I don't believe in the liberal media. This COVID-19 is not going away, right? Science is there. It's been here every day since it started in America. Why do you think it's going to go away? What proof or evidence do you have? So I am saying that anybody who's saying that COVID-19 is going away are being irrational They're not speaking with evidence in front of them or data. I am speaking with data in front of me, evidence in front of me, and I say that liberal media is wrong. COVID-19 is not going away. So, and scientists agree. More and more scientists are agreeing with me. Just like scientists eventually agree with me that you should wear a mask. Um, that COVID-19 is not going to go away. We have to adapt. Sooner we adapt, sooner we can get our economy on the progressive side. Um, the economy is not going to get stronger if we keep trying to force people to go to work and people keep dying, right? It's just counterintuitive to force people to go to work and get COVID and die. This doesn't make sense, logical sense. So I am arguing that protecting life is linked to economic power in the long run, right? In the short run, you may be like, oh yeah, we could sacrifice 1,000 lives per day in America to maintain economic power, but how long can you maintain that when COVID-19 is forever? You see what I'm saying? It is demoralizing to people whose relatives die, and it's demoralizing to communities. The numbers are going to stack up. And I'm Heerak Christian Kim, independent candidate for U.S. Congress in Virginia State District. I'm predicting at least 3 million Americans will die in the next 6 months from flu and COVID-19, in the flu season from COVID-19. And people are going to die from other things too, like flu, mononucleosis, HIV, hepatitis C, cancer. So can you imagine how many millions will die in the next 6 months? It's going to be horrific. Horrific. Yeah. Um, Italy, as you know, we watched videos on how horrible Italy was, and it became worse in New York. And it's going to be horrible in New York again this year. It's expected, unfortunately, because of what COVID-19 is. It's a killer virus that infects, and it's mutating to infect and kill more efficiently, COVID-19. And that's just a horrible thing that's happening, but that's what viruses do. It's just uh, they're behaving in a way they will normally behave as a virus. Italy is number 5 with 365,467 cases, dying at 10% death rate. 36,246 have died so far. The United States could easily have 10% death rate per day. Death rate, our death rate is 2% now. Yeah, I mean, flu season is going to be horrific. There are 2 articles that are kind of significant for you to consider. That's recent, today's articles. That's one by Carolyn Y. Johnson in the Washington Post. Johnson & Johnson pauses COVID-19 vaccine study for unexplained illness. COVID-19 vaccines are failing. It's a serious problem, but they're failing. But I predicted it, that we're not going to have a working virus vaccine that is effective for the next 10 years at least, because we just don't know enough about COVID-19. Scientists don't know enough about them. They're discovering something new every day. So the significant quote is, pharmaceutical giant Johnson & Johnson paused the 60,000 person coronavirus vaccine trial Monday, that was yesterday, after a participant fell ill with undisclosed symptoms. Obviously, it was serious enough, maybe even life-threatening, making it the second large U.S. vaccine trial to halt inoculations as investigators probe whether the sickness may be linked to the vaccine. Experts say the pause by Johnson & Johnson and an ongoing hold on the AstraZeneca trial in the United States demonstrate the system in place to protect the safety of participants is working as intended. So they're trying to put a positive spin on that. But the reality is, it just means that the vaccine has a lot of things to fix, right? Vaccine, they don't know whether it works, but they do know it can hurt people, right? So you want a safe vaccine that doesn't hurt people. That's one of the things you want from your vaccine. And obviously you want the vaccine to work. But right now they can't get the first part right, unfortunately. But it's as I said, for the next 10 years, don't expect the vaccine. And COVID-19 is going to kill every year, like 100 million or more every year, because it's 365 days a year, but it's going to be severe during the winter. It's going to continue on and on. for years and years and years. So just get used to it. You're not going to have a different world. This is the world that you know. This is the world that's going to exist for the next 10, 20 years, maybe longer. Um, you see the World Health Organization expert there talking about chance of COVID-19 reinfections unknown. Well, when some people say it's unknown, that means it could happen. There's a probability that it could happen, right? If they knew, then they'll say, no, you cannot get infected again. Because of the nature of the antibodies, and Dr. Fauci has explained that, Dr. Fauci has come out and said explicitly they could get infected again. Um, yeah, so you have short-term immunity. It could be days, it could be weeks, it could be months, but you could get infected again. So if you got infected with COVID in March and April and suffered and were on ventilator, don't think like you're safe. You'll probably get infected again. Because how did you get infected in the first place? You may have a risky life. You may be socializing too much. Yeah, you can get infected again and you can die the second time. Yes, if you get infected in April and survive, after being on a ventilator for 30 days, you may get infected again in October and die by December. So we're going to have cases like that that we will see. As you see, there's an article that was written. Um, a 25-year-old man becomes first in U.S. to contract coronavirus twice. At least it's documented, right? There could be people who died and it wasn't documented, but this is a documented, evidence-based research. So documented case, that's more accurate because there may be people who got the second time and died. And there is documentation, because not everybody goes to hospital before they die, right? Yeah, I mean, and sometimes, they get mistaken for something else. There are a lot of situations, where there may be more cases, but this is a documented evidence-based research. Um, so 25-year-old becomes first in the U.S. to contract coronavirus twice, with second infection more severe. He's a 25-year-old, right? Yeah, and he could die. People who get infected twice can die. It's by Sam Meredith, CNBC, today's article. The significant quote is a 25-year-old man in the United States state of Nevada has contracted the coronavirus on two separate occasions. A study in the Lancet Infectious Diseases, which is one of the most respected medical journals in the world, showed with patient becoming seriously ill following the second infection. It is the first confirmed case a U.S. patient becoming reinfected with COVID-19 and the fifth known case reported worldwide. So there are 5 cases reported. Doesn't mean there are only 5 cases, right? Because not everybody seeks hospital help. Whatever the reason, they may not have insurance. They might have died before going to the hospital. There may be a lot of reasons why it's not reported. But we're going to have a lot of documented cases in this flu season of people getting infected again and dying from it. As I said, I'm predicting minimum 3 million Americans will get COVID and die from it in 6 months of flu season that's coming. So you're going to have thousands of cases of people who are reinfected for the second time and dying. So that's coming, especially in New York. Yeah, you're going to see so many deaths in New York. It's not even funny. I'm predicting that there's going to be at least 1 million deaths in New York. You can see they're spiking now. They're headed there in the next 6 months. It's sad, but this is a killer virus. What do you expect it to do? You're gonna reason and talk to the virus? Are you gonna be a COVID-19 whisperer? Talk it down so you won't infect people? No. Only way to really survive COVID-19 is shut everything down, isolate in areas where COVID-19 is spreading. There's no other way. So Heerak Christian Kim, that's who I am, independent candidate for U.S. Congress in Virginia's 8th District. And as you know, I'm a registered nurse. I work at Virginia Hospital Center. So if you get COVID-19, come to Virginia Hospital Center. Maybe you will have me as your nurse. Yeah, I mean, emergency room. We have a great emergency room. Emergency room doctors and nurses who will take good care of you. If you have trouble breathing or you have trouble with having keeping your balance, or if you feel like your heart has a pain or lung has pain, just come to the emergency room. You don't want to risk death, right? You want to be safe. When you go to the emergency room, they do the test, they clear you, you go back home, right? Um, yeah, but don't joke around during the COVID-19 flu season. People die, drop dead, if they don't get diagnosed in time. So yeah, don't joke around with your condition, your body. You only get one. Um, yeah. Anyway, I hope that you'll be well and that your children will be well. As you know, I created this show to save you and your children from COVID-19 death. I am running for U.S. Congress in Virginia's 8th District. That's Arlington, Alexandria, Falls Church, and Fairfax County. In order to save you and your children from COVID-19 death, as a policymaker at the national level, working in U.S. Congress, I can save you and save all Americans through scientific ways of handling COVID-19, right? And so you should vote for me because I don't think Don Beyer is doing the work that he needs to do to save America from COVID-19 death, or Virginia's 8th District, Arlington, Alexandria, Falls Church, and Fairfax County from COVID-19 death. That's why you should vote for me. I'm the right man for the job. I'm the one who can make America better. There's a lot of corruption among Republicans and Democrats. Like Nancy Pelosi is hoarding up your stimulus checks, right? Because she has a liberal agenda. How dirty is that? You need money for stuff to buy food. And Nancy Pelosi, the Democratic head of U.S. Congress, is hoarding up your stimulus checks because she wants a liberal agenda certified. I mean, how sick is that? I mean, you need the money. That's why, I think you should vote against Democrats and on November 3rd, just to send a message that you don't approve of this. Um, and there are some Republicans who are, trying to like block your stimulus checks. Vote against them, vote them out. You need to send a message in U.S. Congress and Senate, governor's position, people who are trying to withhold like stimulus from you in this difficult time. You need to vote them out of office. The reason that Franklin Delano Roosevelt was elected is because he wanted to help Americans in need. That's the kind of president we need now. Obviously, I think Democrats are full of it, and Nancy Pelosi is not trying to help you. So I don't think if you elect Biden, it's going to help Americans. And to be honest with you, President Trump has been trying to push through the stimulus. So President Trump may be better than Joe Biden in terms of you getting the stimulus checks. Um, I mean, you gotta vote in people who's going to support your family, right? Right now, we're headed to COVID-19 death. I mean, and this could be for the next 10 years. You don't want a leader who's going to block stimulus checks for some ideology like Nancy Pelosi. I say vote her out. Californians, vote her out. We need people who are going to give you what you need, what your family needs. But anyway, I'll bring more information that you need for tomorrow at tomorrow's show to survive from COVID and to help your children survive from COVID. So tune in tomorrow. I look forward to seeing you tomorrow. Goodbye. See you tomorrow. And stay well.